Denied claims by insurances are a never-ending source of frustration and outrage. But there must be something a patient can do, right? Welcome. I am Martine Bruce, your medical bill whisperer, committed to bringing answers, insights, and solutions to patients like you. While not taking the side of insurance companies, I fight them every day. There are a number of reasons why non-payments could be legitimate. So let us first talk about two misconceptions before going over some common reasons for rejections. As always, I'll share solutions and tips to help you along. Now, this might get a little technical at times, so hang on. I'll clear it up for you. The first misconception on the part of patients is that a deductible is a denial. It is not. It is your share of cost. Do watch my video on the topic. So let us look at the explanation of benefit that explains how a claim was processed. It will show a zero payment by the insurance. But if there is an allowance or covered amount, and if that amount is listed under deductible, then the claim is not denied. Only once your deductible has been met will your insurance start paying. The second misunderstanding is not realizing that some claims cannot be processed as submitted. Due to coding errors, missing or incorrect information, lack of medical records, the claims are pending until corrections are made. Unless all required data is there and is correct, a claim simply cannot go through the system. Now let's look at common reasons for denials. Demographic errors include wrong date of birth or spelling of your name, incorrect insurance ID number or missing subscribers' information, billing last year's plan, or if you have two policies, in the wrong order. Coding errors cost payments, such as when a diagnosis code does not match a procedure. A knee surgery billed for breast cancer will get rejected. The patient may have breast cancer, but it does not justify the need for knee surgery. The exact reason for a test, treatment, or procedure must make sense. Inconsistent codes are next. A diagnosis or procedure inconsistent with a type of license cannot be paid. An eye doctor treating a broken leg. So will a procedure in an incompatible place of service, an inpatient visit in an outpatient setting. Charges deemed unusual end up rejected, especially when unexplained. Too many repeat services, excessive dosage of a drug, service not commonly performed under the circumstances. Administrative errors are all too common but avoidable. Untimely filing always gets denied. Claims must be submitted on time. If the office did not send medical records with a claim or did not respond to your insurance request for those documents, payments can be withheld. Now, patient omissions can lead to issues. Not informing your insurance or the office of changes, new address, new baby, getting or dropping a spouse, your firstborn is getting student insurance. Or you have a new plan this year, even if it is with the same insurance. Or your premium payment was lost or late. And if your plan is now under COBRA, your coverage could be pended while the paperwork goes through. And you must always report to providers and to your insurance when someone in the family now has two policies or drops one. And also when you get Medicare, the carriers will need to determine who pays first. It's called coordination of benefits. No, you may not choose who you want to be primary. There are legal mandates that will decide that. And make sure your premiums are paid on time, especially when switching to COBRA. Your employer will no longer handle them. Return the insurance's questionnaires regarding other insurance policies, coordination of benefits, to avoid denials and you getting a bill. Same with any questionnaire regarding an accident or recent ER visit. If your insurance thinks workers' comp is involved, or your auto policy will pay, or that you will receive a personal injury settlement to cover medical bills, they can and will deny claims. Next, let's see how guidelines from your plan, billing standards, and clinical policies results in many denials. Inclusive means a charge is considered part of a larger or main procedure paid separately. The provider should write it off. For example, the drawing of blood is included with the price of the lab, and the payment for your surgery includes the post-op visit with your surgeon. Not a covered benefit refers to something that your policy does not pay for even when prescribed by a doctor. Over-the-counter medication, therapeutic massage rendered by someone without a medical license. Also, if the service is listed as a specific exclusion, it can't be paid. Infertility treatments, cosmetic surgery, dental care. And do note, some religious plans may exclude abortion and birth control. Not covered will also appear on out-of-network claims. For more on that topic, do watch my special video. Not covered then means the dollar amount that the insurance deems too excessive or exceeding usual and customary prices, and that will not be reimbursed. For HMO patients, outside of area means the service was billed either to the health plan or the medical group in error. The provider must bill the right entity to get paid. EPO or PPO plans use the same denial if there are no out-of-network and no out-of-state benefits, and if the service was not an emergency. And yes, I have a special video on different types of plans. Not medically necessary is a common denial. Usually it means the insurance did not receive any or enough medical records to justify the need for the procedure or treatment. Why did the patient stay overnight in the hospital for a simple migraine? Why treat a child with an adult medication? Why perform an MRI when one was done last month? Investigational or experimental often turns out to be a mere coding error, and we've seen the problem with the knee surgery built for breast cancer. But it could also be a graver issue, a treatment prescribed for a condition not approved by the FDA, doing a radical surgery when traditional treatments have not been tried, prescribing high doses of a highly addictive drug, enrolling a struggling teenager in a controversial mental health therapy. Not authorized is usually because the provider did not request a necessary authorization or the request was not granted ahead of time. Of course, if the authorization number is not on the claim, a denial is likely to follow. Pre-existing is seen now in rare occasions. It means that only a new or acute condition is covered. And last, primary EOB missing. It means the provider billed the secondary policy without attaching the primary insurance's EOB showing how much you owe, or that they billed the secondary carrier first in error. So there are solutions. But first, is it really a denial? If it is, what is the exact reason? And what action needs to be taken and by whom? So get your insurance and provider's system updated with your most recent information. Make sure you and the office respond promptly to any request or questionnaire from your insurance. Confirm the right person took the right action and that the insurance is on it. You can check online for a new EOB or call a representative for status. And now hold your breath, light a candle or 10, and payment should eventually be made if payment is due. If a denial still remains denied after action was taken, an appeal may need to be filed, but that's for another video. And some last tips. Do set up automatic premium payments to avoid suspension or cancellation of coverage, especially on COBRA. It's a pain to get claims reprocessed, but could have been paid right away. Contact your insurance if the EOB shows you owe nothing but you receive a bill. They will call the office to get that nonsense stopped. If the EOB shows you are responsible but it's not your fault, call them as well. They should issue a new EOB with no liability to you. And if the insurance is taking too long, complain to a supervisor. And if a denial needs to go into appeal, do consult a specialized advocate to determine your options for a successful overturn, because you, patient, have rights. Insurance companies have a duty to you, and providers have rules they must abide by. I do thank you for watching and for helping this channel grow with your subscribe, likes, and comments. Thank you for helping me reach out to more patients like you.